My name's Katie, and I'm going to be administering medications via peg tube today. First, I would come over and wash my hands with soap and water, and then I would come back over to my cart. I would check the order to see what was ordered, and then I would unlock the cart and get my medication out, which is 500 milligrams of acetaminophen. I would check it with the MAR, make sure it was right. I would pop it in here and then pour it into this bag. I would crush it finely, pour it back into my cup, and I would put it on my cow. I also have my water and syringe already on my cow. I would take it to the patient's bedside. And knock. Hi, Mr. Smith. I'm Katie. I'm a youth student nurse. I'm here today to administer your acetaminophen for your pain through your peg tube. Can I get your name and date of birth, please? Okay. Do you have any allergies? I see you're allergic to aspirin. I would raise the bed to a comfortable working height. And have to provide privacy, and I have to cover the gloves. I have to put my gloves on. Pull the covers back, all while keeping the patient covered. Okay. Now, I would check for residual first. I would draw back, making sure that it's not more than 50 milliliters. If so, I would contact the physician before administering the meds. I would slowly push that back in, clamp and close. I would draw up 30 mils of water to flush the line with. And push that in. I would draw up the amount of water needed to mix with my medication. I just put it into my cup, stir it up, and then I would pull it up, put it in, and then I would pull my syringe out and let the medication go to gravity. After that was done, I would remove this, clamp it first, and close it. And then I would draw up 30 mils of water, flush the line again, clamp it and close it. And then I would cover my patient back up, lower the bed to the lowest position. I would leave his head raised for a little while so that make sure he didn't have any acid reflux. And I'm done. Now I'm going to list the 3 sites for subcutaneous injections and intramuscular injections. For subcutaneous, you can do the abdomen, the upper back, or the back of the arm. For intramuscular, you would find the acromion process first, and then just slide your arm up and around and make a V, and you would give the injection in between my 2 fingers. For the ventrogluteal, I would find the greater trochanter first and have her abductor leg, and then I would place my hand, making sure that my index finger was on the anterior superior iliac spine and my middle finger was palpating the iliac crest, and I would give my injection in between my fingers. And for the vastus lateralis, I would find the greater trochanter, have her abductor leg, and the patella. I would just make a window and point my fingers in and give the injection in between. And we're done.